Group A streptococcal disease are a group of conditions that are caused by a bacteria called Group A strep. The one that people are probably most familiar with is strep throat. Strep throat is a relatively common infection, especially in children of school age, so between age 5 and 15 years of age. It's very unusual in children under 3 years of age. A child with strep throat might have symptoms that consist of severe sore throat, usually with pretty rapid onset. They might have fever. They might have enlargement of the lymph nodes, the little nodes in the front of the neck. And if you look at the back of their throat, it probably looks red, and they may have pus on their tonsils. Strep throat is one of those infections that requires antibiotics to treat it. We treat this infection for a number of reasons. One is it can make your symptoms go away much faster. Two is that it decreases the chances of spreading it to someone else. And three is to prevent future complications. There are a few complications. People might be familiar with things like rheumatic fever, for example, where we know that treating the strep throat reduces your risk of having those complications. So it's important to recognize that if your child has a sore throat, but it comes along with other symptoms like a runny nose and cough, it is much more likely that that is being caused by a virus and not a bacteria. So that's why it's important to talk to your child's healthcare provider because they can sort through the symptoms and decide whether it sounds reasonable to test your child for strep throat or if their sore throat is more likely to be caused by a virus.